Did you know that one simple mistake while checking your blood pressure could completely mess up your health readings, even in a doctor's office? Stick with me to find out exactly what you're doing wrong and how to fix it. But before we dive in, let me introduce myself. My name is Tuba. I'm a biotechnologist with a passion for sharing the latest health research on common diseases. Through my videos, I provide trustworthy and actionable information that empowers you to improve your health and make confident, informed decisions. Now, let's get straight to it, starting with the first mistake almost everyone has made at some point, using the arm cuff over clothing. It seems harmless, right? Just strap it over your sleeve, press the button, and voila. But here's the kicker. This one misstep can skew your results by as much as 10 to 20 points. That's enough to make a healthy person think they're on the brink of a hypertensive crisis. The truth is, blood pressure cuffs are designed to be used directly on your skin. Fabric, no matter how thin, creates interference, leading to inaccurate readings. So, whether you're bundled up in a cozy sweater or rocking a long-sleeve shirt, take a moment to roll up that sleeve. Trust me, accuracy is worth that tiny bit of extra effort. Don't you agree? Let's move on to mistake number 2, your arm's position during the reading. Did you know that having your arm at the wrong height can completely throw off your results? Your arm should be at the same level as your heart, neither dangling by your side nor propped up too high. Here's why this matters. If your arm is too low, gravity increases pressure in your blood vessels, leading to a falsely high reading. If it's too high, you might end up with numbers that are lower than they actually are. Even trained medical professionals sometimes overlook this detail. So, the next time you're getting your blood pressure checked, don't hesitate to ask for an adjustment. Your health is worth speaking up for, isn't it? Now, this next one might hit home for many of you, checking your blood pressure too often. Picture this. You check your blood pressure in the morning, and it's a little high. You get worried, so you check it again an hour later. Then after lunch. Then before dinner. Before you know it, you've taken 10 readings in one day, and now you're more stressed than when you started. This is what I call the blood pressure rabbit hole. The truth is, your blood pressure naturally fluctuates throughout the day, influenced by things like what you've eaten, your level of activity, and even your stress levels. Instead of fixating on these moment-to-moment changes, focus on consistency. Choose one specific time each day, ideally in the morning before eating or drinking anything, and stick to it. This approach will help you identify meaningful patterns over time instead of stressing over small, irrelevant fluctuations. Here's another mistake that's surprisingly common: tightening the cuff too much. Have you ever felt like your arm was being squeezed by a boa constrictor during a blood pressure check? While the cuff does need to be snug, it shouldn't feel like it's cutting off your circulation. As a general rule, you should be able to slide 2 fingers between the cuff and your arm. If it's too tight, your reading could be artificially high. If it's too loose, the reading might be misleadingly low. It's all about finding that sweet spot. Once you've nailed this balance, you can trust the numbers you're seeing. Now, let me ask you, how old is your blood pressure monitor? If you can't remember, it's time to take a closer look. These devices aren't built to last forever. Over time, the cuff material can wear out, tubing can develop leaks, and the sensors may lose accuracy. I can't tell you how many times I've seen people relying on machines that are long past their prime. The solution? Invest in a reliable, high-quality monitor and inspect it regularly for signs of wear and tear. You don't need the latest, most expensive model, just one that delivers consistent, accurate results. And when your current monitor starts showing signs of age, don't hesitate to replace it. After all, isn't your health worth that investment? By the way, if you're looking for a reliable recommendation, I highly suggest the Omron Platinum Blood Pressure Monitor. It's accurate, durable, and trusted by experts. You'll find the link to it in the description below. Here's another crucial tip: always rest before taking a reading. Blood pressure is meant to reflect your body at rest, not after a frantic dash to your doctor's office. Yet, how many of us have been rushed straight into an exam room, strapped to a cuff, and told to sit still? That's like measuring a marathon runner's heart rate at the finish line. Always take 5 to 10 minutes to sit quietly and breathe deeply before a reading. This simple step can make a world of difference. Are you taking cold, allergy, or flu medications? Here's something most people don't know. Many over-the-counter drugs can raise your blood pressure. These medications often contain ingredients like decongestants, which constrict your blood vessels. If you're checking your blood pressure while taking these meds, the numbers might not reflect your baseline health. It's like measuring the calmness of a lake during a storm. Wait until you're off the medication before taking your readings. Another often overlooked factor? A full bladder. Believe it or not, holding it in can raise your blood pressure significantly. When your bladder is full, your body activates its stress response, temporarily increasing blood pressure. Before you check your numbers, make a quick trip to the restroom. It's an easy fix that could save you from an unnecessary hypertension scare. Speaking of comfort, here's a simple but vital tip. Don't cross your legs while taking a reading. It might feel natural, but crossing your legs restricts blood flow and can artificially elevate your numbers. Sit with your feet flat on the floor and your back supported. It's not just about comfort, it's about accuracy. Now let's talk about caffeine. I know mornings can feel impossible without that cup of coffee, but did you know caffeine can spike your blood pressure by up to 40 points? Even if you feel calm, your blood vessels are constricting, and your body is in overdrive. If you have a reading or doctor's appointment coming up, skip the caffeine for at least a few hours beforehand. Your numbers and your heart will thank you. Lastly, let's bust a common myth. A single reading isn't enough to diagnose hypertension. True high blood pressure is a pattern of elevated readings over time, not a one-off result. If your doctor makes a diagnosis or prescribes medication based on just one reading, don't hesitate to ask for more tests. Better yet, learn to monitor your blood pressure at home. Consistent data is your best ally in understanding your health. I'm 100% sure you don't know the real cause of high blood pressure. Watch this video to uncover the shocking truth and learn how to lower it instantly.